For every patient that a doctor sees, they'll present with something, an issue that they're facing, and then you have to try and work out how to address that, treat the patient, ensure that the management plan works out, and also treat them as a partner, communicate well. You meet people from all walks of life, different languages, different backgrounds, different cultures. As a doctor, you've got to be dynamic, adapt, make sure you're supporting that patient as best as you can.
What does it take to be a great doctor CEO? So with today's guest, we have Dr. Ben Maruthappu, who is the founder and CEO of Cera. Tell you a little bit more about Cera. And I'm sure you may have heard of him or even listened to a number of interviews and podcasts that he's done. So we're not talking about how much he raised and the technical aspects of how he grew the business. We're talking about what does it take for him to grow a successful business? What mindset shifts did he need to make to be successful? And also we talk about hiring. What is it that these kind of companies look for in great team members? There's so many golden nuggets in this. You absolutely don't want to miss it, particularly if you're someone that's interested in health tech and someone who is a leader that wants to make an impact at scale. And before we get into that, don't forget to subscribe to our community at medicfootprints.org/join our mission. Anyway, onto the show.
So let's get real. Our value as doctors has significantly diminished over the last decade. So how can we turn that around by upskilling and creating rewarding and impactful careers on our own terms? Welcome to Disrupting Doctors' Careers. I'm your host, Dr. Abeyna Bubbers-Jones, and I'm on a mission to connect 1 million talented doctors with the best in diverse career opportunities.
So welcome to this episode of Disrupting Doctors' Careers. As you know, we talk about entrepreneurialism quite a lot. And today we are going to dive back into the world of health tech and discover what is it like to be a doctor CEO. So that's a chief executive officer. So as you know, I am one of the NHS clinical entrepreneurs, and I think actually was in the first cohort. And so with me today is Dr. Ben Maruthappu, who many of you would probably have heard of already, who has a ridiculous amount of accolades, I have to say. I was looking at his LinkedIn today, which was just crazy. And we'll talk about that in this episode. But anyway, he is the CEO of Cera, which is Europe's largest provider of digital first home healthcare. So that involves moving services out of hospitals into people's home. It's had a lot of press, it's had a lot of PR, and it's really innovating at the forefront of what we need in healthcare, bringing it back into people's homes. And that is spearheaded by Ben and obviously his amazing team. So today we're really going to get to the bottom of what is it really like to be CEO of one of the UK's fastest growing health tech companies. So welcome, Ben.
Hi, great to be here. Thank you for inviting me. I'm looking forward to this discussion. I've been looking forward to it for a while. So
Great. Thank you. And I mean, I was saying just beforehand, I've listened to a number of podcasts that you featured in, and I really would love to get to the bottom of really what it takes. So increasingly, we're getting more into you've got the technical, and as doctors, we're very technical focused, but there's the mindset, which actually is a big part of the success journey. So actually, let's go back, because as I said, I checked out your LinkedIn this morning and I was gobsmacked. I was absolutely, as doctors, we like to achieve a lot of things, and we're go-getters, we're qualification junkies, we have a lot of accolades, and I have to say I knew some of this stuff, but I didn't know all of this stuff, and that's probably just what you've only put down. I just want to list a few things. So as you know, you're CEO of Cera, which was impressive enough on its own, but there are other things like your board member, senior advisor to Bain, you're the co-founder of the NHS Innovation Accelerator, did other NHS board member things, MBE. I didn't even know that. All right. I was ultra impressed, expert advisor to WHO. And yeah, and like so many things that actually, I'm like, actually, are you Superman? That was like, we see certain people who have achieved a lot. And it's like, actually, how have you achieved that in your years? So my first question for you, Ben, is what drives you?
I mean, that's a great question. I think so when I guess the reason why I became a doctor, as an example, was linked to work experience I did as a teenager in a hospital ward in a cardiology department, and seeing how with just a few medications, someone who'd had a tragic event could go back home almost healthy and recover from their heart attack or cardiovascular event. And the reason that resonated with me a lot was because when I was younger, my father passed away. So when I was 12, and he passed away from a heart attack. And it was that combination of going through that as a young child, but then also as a teenager, seeing how you could potentially treat people and avoid difficult circumstances like that, which gave me a really deep motivation for becoming a doctor. And in the same way, when I co-founded Cera, it was also because of an event that I went through with one of my parents. So in this instance, my mother had a fall, she fractured her back, she needed care at home. It was a really difficult experience to get a carer organized. And actually, my sister, aunt, and I ended up looking after my mum ourselves for a while, because we couldn't get a carer to come visit her for some time. And that experience motivated me in turn to try and build Cera, a company that could deliver better care, better healthcare in the home, and look after the oldest and most vulnerable, and give family members of those individuals some peace of mind and some connectivity as to and insight as to what was going on to their loved one through technology. So I think what drives me and what motivates me is usually being quite significant personal experiences that make me in turn very passionate about what I'm doing at that point. So being a doctor, has been a huge part of my life over the past years, and in turn, building Cera has been another big part of my life. And I think both of those experiences go down to quite deep roots during the years that I've grown up and beyond.
I mean, obviously that makes sense. Most entrepreneurs, their journeys start from something personal to them that they've experienced or they've seen other people experienced. And it absolutely makes sense as to that journey for you in healthcare, because I know at some point you had a choice, but you were working at Citibank, for example, and there was a choice between that and medicine. Like what? And I mean, I'm guessing, but what was it that made you decide I'm going to go on the healthcare side rather than the banking side?
I think so to answer that, let me rewind a bit. I mean, the reason I interned at Citi and also at a management consulting firm was because I became increasingly interested in business. And I had spent time at medical school as part of societies or even charities, and seeing how they could impact more people. And I thought, okay, well, what would it be like to work in business and get exposure to that from a managerial perspective? And so that's why I interned in those organizations. But while I realized I did want to later down the line get involved in a company or developing a company, my major passion was healthcare. That's what my heart was really in. And so when I had a choice of kind of staying at Citi, where the role I was going to have wasn't actually in healthcare, it was kind of across different sectors, versus continuing my training to be a doctor, being able to work in a hospital, and then later on, I thought I'd be able to have the opportunity to bring healthcare into a business setting, depending on what may happen. I thought that was the right path for me. And so I continuously try to follow what I'm passionate about and what on a deep level really motivates me, rather than necessarily looking at the best job opportunities, how you could put it. I think when you then become an entrepreneur, that's really important, because entrepreneurship is tough, and you're going to have difficult experiences. You're going to have points where you ask yourself, oh, why am I doing this, and so on. And then you've got to go back to what your first motivator was and what drives you and makes you passionate about it. And so I think if I look more generally, there are a lot of entrepreneurs out there who have some kind of mission or passion that is motivating them. They went through an experience, they want to right a wrong, they want to provide a better service or experience for other people who've been through what they went through, and that's why they do what they do. And I think in entrepreneurship, it's extremely important. And to be honest, same with practicing medicine. I mean, now more than ever, working in the NHS is challenging, right? There's a huge amount of pressure, strikes. We're going into winter now, and we've come out of the pandemic where some staff and colleagues in the NHS are burned out. All sorts of things are going on, and to be able to just kind of go through those different storms or kind of surf those waves, you need to be very passionate about what you're doing, and it needs to really resonate with you on a deep level. Otherwise, it's hard to stay the course.
I mean, absolutely, I 100% agree. And I mean, recently, when you said some healthcare workers are burnt out, I'd say health and social care is burnt out in the sense that, I'm continuing as a occupational health physician. The other day, I spoke to a social worker who was clearly extremely passionate about what they did, but just under a remarkable amount of stress due to the demands placed of them. So they were getting more and more cases, but less and less time, and at the point of breaking, basically. But this person was unable to even stop or leave their job and could barely even speak at the time because they were so committed to their cause and their mission. And it's similar to any careers, and for doctors who are changing careers, one of the things in our Doctors in Industry program that we really focus on at the start is, what is your big why? Like, why are you going for this sector or this career pathway? Like, if you're not clear on that, you will fall at the first hurdle, regardless of whether it's entrepreneurialism or any career opportunity, because as you've described, actually changing careers is hard. Like, working in industry is hard, and life is hard, right? And so in order to really give yourself the best chance of success, it's important to actually be clear on what your North Star is. And so it's great to hear that you have that clarity and you have that personal tie to the big why, is what I describe it. But just going back a little bit, because I mean, we all have a lot of personal experiences that we're driven by, that we're mission led by, but I'd love to hear a little bit more, because again, observationally, and going back to the LinkedIn, you see, and actually I probably know the answer, but I'd love to hear from you, because I don't like to assume anything. I noticed that a lot of the things that you have done, you are the head of it, like the president of this society, or the chairman of this, or the co-founder of this, which again is impressive. But again, I'm just really curious as to why in that journey have you always been at that top position? Like, what does that mean for you in achieving your mission?
I mean, that's a good observation. I haven't actually spotted that myself, if I'm honest. I think in a lot of instances, when I become the kind of the manager or the leader, it's where I've had an idea and I've set it up. So I become the co-founder and then, the manager or CEO equivalent, as I'm in Cera. And that's because from a young age, I mean, I'd look at issues or challenges and think, okay, well, how can we approach that differently? What's the solution to that problem? How can we make it better? And I was always really interested in problem solving from a young age. And I think, and I like to do things a bit differently, I guess. I like to go against the grain, sometimes be innovative where possible, be disruptive, to use kind of the phrase that you mentioned earlier. And And then you have to, I think, if you want to come up with a new idea or a new solution to a problem, and you're the only one there from the beginning, then you kind of are in charge, because it's just you. But then you bring a team together and you try and bring them around a mission, and then you set them the direction, and off we go. And so I think it's more about me usually being the person who says, well, why can't we do this? And then trying to mobilize colleagues, friends, to try and get something done about it. And it's the same with Cera, right? I mean, I thought that care could be it, that looks after people in their homes, could be better. I think I met a number of care workers and in turn social workers who were so resilient, well-intentioned, really wanted to go above and beyond for the people they're looking after, but they were limited by the tools of the organization. The whole thing was run on pen and paper as a sector. People think the NHS is backwards. Social care is way worse, about 20 years behind the NHS. And I thought there are some basic technologies, there's some basic tools here that we could introduce to make it better. And at that time, when I co-founded Cera, there weren't many examples of technology being used in social care. Yes, there were in the NHS, in GP practices and hospitals, that was emerging, but in social care, really barely any. And so I thought, well, why don't we set something up to do something about it and to make the sector better for frontline staff, and then of course for patients, and then for family members. And so having that idea or wanting to solve that challenge and that problem automatically kind of put me in a leadership position. So I think it's probably more about me being the co-founder or the instigator who kicks things off. And that's what puts me in that position, rather than necessarily me wanting to be in that position, because I think there's a lot of responsibility that comes with being the leader, especially as an organization gets bigger. And that is a weight in itself, right? And it's part of that. Yes, it's kind of a duty and it's a way to serve, but also it presents its own challenges with it.
Well, thank you so much for sharing that. And actually, it totally makes sense at the end of the day. I was actually, the next question, I'm pausing it. The next question I was going to focus on was really to talk about mindset shifts. My question was going to be, what mindset shifts do you need to take to become a CEO from being a doctor? But from what you've described, your mindset was set a long time ago as a result of your experiences, and actually your mindset wasn't that of what we see as a typical doctor. So I'd love to really understand for you, because again, I couldn't see any point actually in your career journey where you've just been a clinical doctor without all the other things that you had going on in the background. But if we step back a bit, what mindset shifts have you personally had to make moving from the clinical to the CEO, even though you have had that experience, like you've been primed for that with all of the things that you've done on the way?
So, I mean, firstly, I'd say doctors have a lot of skills that set them up to be great entrepreneurs, in my opinion. You've got to be good at communicating. You've got to be resilient and persistent and work hard. You need to almost be able to diagnose an issue and solve it, which for every patient that a doctor sees, they'll present with something, an issue that they're facing, and then you have to try and work out how to address that, treat the patient, ensure that the management plan works out, and also treat them as a partner, communicate well. You meet people from all walks of life, different languages, different backgrounds, different cultures. As a doctor, you've got to be dynamic, adapt, make sure you're supporting that patient as best as you can. All of those skills come in and are very valuable as an entrepreneur, or every single one of the ones I just mentioned. I think, and doctors also are, lots of them tend to do kind of research or kind of audits, always trying to think about how do we do things better, how do we approach it differently. And so I think that sets doctors up incredibly well to be strong entrepreneurs. I think for me, the biggest changes to your question that I had to go through from being a clinician to being an entrepreneur was, firstly, as a doctor, it was a lot more about what I can do for the patient. What I can do for the patient who's sitting opposite the table from me, who's come in for their appointment or who I'm seeing on a hospital ward round. Whereas when you start building an organization, you have much more of a leadership role. And that, I think, is about having a culture, setting the right values for that organization, and making sure people have the right ecosystem to really thrive. I'm not the person who's delivering care to the people that Cera is serving. I need to set up the right conditions so that our carers, nurses, our frontline staff can do a great job of looking after people. I have to help them help our patients. And so you're one step removed, and that requires a different mindset. And sometimes as a doctor, you want to kind of dive in and be like, well, maybe I need to make that change. Maybe I need to be the one who does it, in the same way that, maybe if you haven't got the blood test results, you'll call up biochemistry and try and get the results, right? Or if radiology is being a bit slow, you think, do you mind doing this ultrasound a bit faster? You'll step in, but you can't always do that in an organization with lots of people. You have to empower those people to go further. So I think that's a shift from the actions being about you to the actions being about other people and you supporting them in getting stuff done and being successful. I think another big change was, and it's linked to the point I just mentioned, is organizations, companies, their success, it's down to the people. Even if it's a technology company, it is really down to the talent and the people. And I think one of the best things a good founder can do, or a good CEO, is ensuring that they hire great people. And so before I had worked at Cera, I had never hired anyone for a full-time job. I'd never gone through that process, and then had to manage them, make sure they're set up for success in their first few months, and so on. And that's been a big learning experience for me. Talent, recruitment, and management, I think, is a huge part of a leader or CEO or founder's role. And it's not just them. I mean, everyone in a startup or scale up will be hiring at some point or another, and hiring well, it's a critical skill. It's crucial. And that's something I had to learn on the job, right? Because I just hadn't done that before. But then again, as a doctor, you've got to be a good communicator. You have to be able to get on with people. It sets you up well for being able to transition. But it was a new muscle that I had to develop. And because, again, as a clinician, you are even more likely to be someone who, yes, you're great at maybe liaising with people, understanding healthcare, but you may not be good at reading a P&L or some accounts from a financial point of view. You may not necessarily be good at writing code if it's a technology-based company. And you need people who can work with you to do that. And that's why hiring becomes even more important. Surrounding yourself with talented people so that collectively as a team, you can fulfill your company's mission, you can deliver against your deliverables. That's only possible if you've got a great team. And I think as a doctor, that's a skill too, and that's a transition to really develop and focus on.
100% agree. I think talent, hiring, workplace health, it's one of my real passions in life. Particularly, I mean, recently I went to New York to the LinkedIn Talent Connect Summit. 2,000 talent leaders from some of the biggest brands in the world together under the same massive hangar type roof. But I absolutely 100% agree with you, and I've seen that time and time again, even with my own team. But I'd love to hear from you, because, like, for example, LinkedIn at the moment, they're very hot on hashtag skills first hiring, right? That's their thing. But pretty much every hiring manager, every founder, everyone I've spoken to, particularly in the health tech space, are like, forget skills. It's less about that. It's actually more about finding someone or finding a team member who's curious, who's motivated, who's driven by our mission, as you've indicated before. So I'd love to hear from you as to what are the key things that you look for in a new team member, as you're growing the company? Is it and this is particularly for doctors who are like, is it the MBA? Is it the qualifications? Or is there something else that's actually more valuable to an organization like yours?
So I'll just start off. It's not the qualifications. I'll just say that straight away. It's I think what I've looked for has changed over the years as the company has gone through different phases. So in the earlier stages, having people who were really willing to roll up their sleeves, smart, dynamic, hardworking, that was what was most important, right? But as Cera has evolved and we become bigger, finding people with certain specialisms has become more important. Like we need a specific type of software engineer or data scientist, or we need someone with specific experiences when it comes to marketing and branding or partnerships. So that specialism has become more important. For me, though, outside of their broader experience, which determines which role they may fit best into, I tend to look for what, as per your first question, what motivates them? What are they passionate about? Cera is a very mission-focused company, and if they're just if there's certain passions which may mean that you're probably better off in a fintech business, right? Rather than a health tech business. I think you've got to being motivated about making an impact. I think is a crucial part of the DNA of someone who joins Cera and someone who joins a health tech company. And so the why and what motivates, what they're passionate about, for me, regardless of the role and also regardless of the stage that Cera's been at, has been top of my list. Then actually asking people about challenges that they've been through, right? When hasn't it worked out? When have you failed? And not like a kind of, this happened, but then everything worked out hunky-dory and it was really good. But a genuine setback or failure, and how did you deal with that as a person? And I say that because when you're building a company or you're trying to do something different, you're going to fail pretty much every day, every week. So how you respond to that, whether you bounce back, whether you pick yourself back up, or whether you don't, that I think is an important determinant. So whether you're going to succeed in a startup and scale-up environment. So I tend to really ask people about experiences that they've been through that haven't worked out, what they learned from it, and how they responded to it. That's probably the second big area that I zoom in on. I think when it comes to hiring and looking for talent, it's definitely not. I mean, I've met people with MBAs who are great, but the MBAs are not what makes them great. I've met people with MBAs who just are not necessarily a right fit for our organization as well. So it's less about that. It's more about the actual person.
Absolutely, and that actually presents a challenge in itself, because how do you assess for that, especially at the first stage where you advertise a job, you get hundreds of applications, and most of them are kind of technically focused or skills focused. How do you get behind that and beneath that on paper? How does that work for you?
Yeah, I mean, it's not easy. You're absolutely right. And normally it's when I meet people that I can start asking these questions and really think with it. I think before that, it's more difficult. But then you can look at, what types of organizations has a person worked at before? And sometimes I'll recognize them. And one example is we hired someone senior at Deliveroo to Cera. And he was at Deliveroo for several years. Deliveroo is not an easy place to work at. Let me tell you, because they've gone through their own twists and turns. It's quite an intense culture. And there are lots of people who've gone in and out of that organization. And so just off the back of it, I kind of know if someone spent a number of years there, they probably pretty resilient and must have really given it a lot of effort. I mean, to use a kind of much more extreme but mixed example, I mean, Babylon Health has been through a very difficult journey recently, and it's quite well publicized in that regard. But I know people who worked there for a number of years, and then they went on to do other things, and it wasn't an easy environment for them to work in. But the fact that they tried and kept at it for a period shows that they must have been pretty persistent, pretty resilient to do that and to stick at it. Even more recently, where Babylon went through a lot of financial difficulty and now has been bought by a US company, some people have went through that journey, and when they knew that that company was going through difficulty, they didn't just throw in the towel and say, I'm jumping ship. They kind of kept at it, right? I know some of the senior people in that company who were trying to keep it steady. Not the founder, but people who are kind of in the UK and involved in the NHS work that Babylon does. They were trying to keep it steady, despite the fact that they knew lots of things were going in the wrong direction. And they did that because they wanted to be there for the patients, right? They said, and also for some of the clinicians who were delivering GP services to patients as part of GP at Hand. And they kept going because they felt that kind of duty to the people that were being seen and treated, the patients, but also to frontline staff. That's, that shows a lot about that individual. There's a lot one could say about Babylon as an organization, but for individuals who did that, it says a lot. It speaks about their character. It speaks about their loyalty as well to their frontline colleagues, to their patients. And it's hard to kind of place let's say a pound figure on that, right? It stands for a lot more. And you can see when someone applies with their CV, okay, this person may have been through a lot, but they stuck at it, and I think that's a positive thing.
No, and I totally hear you, and I totally agree. It's interesting. I mean, particularly healthcare in general. Most people in healthcare are not doing it for the money or for the power or for the kudos. They're doing it because they generally want to make an impact and serve patients and help improve people's lives, right? So generally speaking, I'd say most people in healthcare, regardless of whether they're clinicians or not, like you would comparatively, as I said, compared to fintech, would see a maybe higher level of loyalty than, say, you might do in other sectors. But I mean, going back to your point about one of the ways you assess is looking at previous work history. Considering this podcast is about doctors, a lot of whom are jumping ship or diversifying their portfolio careers. How do you assess for those hidden gems that may not have worked for those deliveries or Babylon Health? Like, what other ways are there to really assess, again, at the earlier stages of that pathway, to demonstrate that they are the motivated ones rather than the ones that are changing careers for the push factors?
Yeah, of course. So I think people who have if they're applying to a health tech company that's focused on diabetes, and they've, let's say, done some research that shows they're really passionate about that in the past, or they've worked in endocrinology, or they've tried to make an effort to get exposure to working in a startup before, that's all really positive. I think the other piece I'd mention is, I do interview a lot of people, right? I spend a lot of my time meeting and interviewing because of the very reason that you've said, which is that what's on paper is not always what you see in front of you, right? And I really love giving people a chance who maybe they haven't been able to focus on their kind of career achievements or their experience placements as much for whatever reasons, but they're very motivated and they want a shot. I actively look out for those people. And so it's, in those instances, it could just be someone who's sent me an email and says, hey, I've looked at what you're doing. I'd kind of love to spend a day in the office, learn a bit more. And they're kind of persistent in chasing that down, right? They kind of follow up a lot, and that has nothing to do with their CV. It's more that they are really making an effort and trying to push themselves and open doors to get an opportunity. I think that also makes a big difference, regardless of what your previous experiences are or what hospitals you may or may not have worked at.
Yeah, no, I totally agree, because it is those ones that are resilient, persistent, and because they're the ones that stay top of mind, right? And you really want to help those people, don't you? Like, you genuinely want to help them get ahead because you can see that the genuine passion for what you're doing. So I think those are all really great points, and these are things that we advise our community and our fellows again and again, because, you know, the mindset of doctors is like, I don't want to bother anyone, I don't want to be spamming anyone, I don't want to put myself out there because then they'll get upset. Like that is the mindset that we, like, as doctors traditionally have, but in industry, in the wider world, like, that is what gets you the job, right? That is what opened doors. It's like having the patient that, you know, the annoying patient, I put in inverted commas, who is always calling up, who is always making a fuss. Like, they do stay top of mind, so actually they are more likely to get what they need. So yeah, no, I completely agree with that. So the last part of this is talking about influencing healthcare, making an impact globally on a broader scale. And I guess we touched upon this but let's clarify a little bit more about, what does making an impact mean for you? Like, what does that look like? How do you know that you've been successful in what drives you in your mission? And how does that compare to what you could have achieved as a clinician?
I think, I mean, for me, and this has changed over the years a lot, but I think right now, how do I know that I'm making an impact in the context of Cera? It's, on the one hand, kind of more anecdotal, subjective.
Yes.
It's what people are saying. It's that person who writes kind of a letter and just to say, we really appreciate the care that our loved one received in their last few months. And the carer who was looking after them was by their side every step of the way, and it meant such an important difference for our family. Reading that, it doesn't matter what the numbers are or the scale is, just reading that one letter, I find it, you know, that makes the hard work all worth it, right? And what we're trying to do. And in the same way, it's not just patients and their families, it's our staff, right? Having a nurse who says, Ben, I love using our technology. It's kind of reignited my motivation for being a nurse and for seeing patients after many years of kind of being a bit worn down by the system. And that makes a big difference, right? So there's the anecdotal, it's the stories, it's the narratives that people will give day in, day out. And then outside of that, it is looking at, you know, there are certain almost metrics that we use and measure at Cera that are important to us, such as based on the work we do. And some of that could be satisfaction scores from our staff, from our patients, but also actual health outcomes about people going to hospitalize and being hospitalized, or the number of falls that individuals are looking after. Because at Cera, we tend to look after very old, vulnerable people, where the number one reason they end up in hospital is they've had a fall. So every fall that we can prevent potentially is a fractured hip that's been avoided, is a hugely tragic event that's been avoided for that individual, so that they can continue living independently. And so there are kind of metrics as well that we use and that I use to track the impact that we're having on the people we are serving and responsible for. And it's that combination of the individual and the story and the experience that they have and how we're trying to change their lives with our mission, but also kind of the trying to track that at scale, which usually involves some form of metric. That's how I kind of look at impact.
Absolutely. It's the stories combined with the metrics. And I'm 100% driven by the stories and the feedback that, you know, a lot of the times we don't even solicit it. Do you know what I mean? And but it's even better that way, where people genuinely, like, they reach out to you and say, genuinely, like, as a result of what you're doing, I'm now able to do this. I got my life back. I was able to look after my family from Medic Footprint's perspective. I took the leap, and now I'm the founder of this company. I managed to, you know, it's those stories that keep me going. Because as you've described, as you know, having a big why is important, and it is a really, really challenging journey. So my absolute last question, like, as an entrepreneur, as a CEO, as you alluded to earlier, you know, it's quite there's a lot of heavy lifting going on, right? Especially with the growing business, especially with a growing family too. Would you say, are there any sacrifices that you've had to make in order to sustain you, your life, your business? Like, what do you think on this journey?
I mean, I think that I've had to, more in the earlier years of Cera than now, I had to work probably much harder than I did before. And I thought I was pretty hardworking. But when in the first couple of years of Cera, where we had to really get it up from zero to something, that was a big lift. And that meant spending less time with friends and family that's extremely important to me, with my partner. So those were sacrifices that I made. Since then, I've tried to put in place measures, processes, a team. That means I don't have to be doing so much for the lifting myself. And now that I have, a 4-month-old son, it's more important than ever before, because I don't want to miss any of those moments, right? It's so precious. And family time is so precious. Maintaining my health, really important. And so I try and be much more balanced than I used to be. And it's just like, for telling the team, okay, well, I'm available during these times. If it's an emergency outside of that, fine. But really, apart from that, politely, I don't want to hear from you. Just in terms of how when I take meetings, and kind of even I used to travel a lot more abroad. Now I do it less. Things like that, just ensuring that I put guardrails so that, yes, I can work well, but that is not coming at a compromise to my personal well-being, my family health, me being a holistic person, how I'm being there for my friends as well, or relatives if they're going through tough times. I try and make sure that it doesn't get in the way of that. It did in the earlier years, but now having learned from that, tried to prevent it from happening again.
Do you feel, again, this is more for doctors or entrepreneurs who are going through those early stages, do you feel that had you put in those guardrails earlier, that you still would have achieved the same outcomes? Or do you feel like actually that was a necessity, like it couldn't have grown as quickly as it did without that, if you understand what I mean?
I think that the first steps of building a company are tough, right? I mean, I think if you talk to anyone who's trying to set up a business, or you read books about famous entrepreneurs who now are kind of probably chilling on a beach or whatever, they had to kind of go through difficult times as well. I think I could have been smarter, though, about how I use my time. And also, I feel if I had the right and perhaps a stronger team around me earlier on, to my point around hiring well and being really sharp on talent, that also could have allowed me to have a more balanced life in the earlier years of Cera. And so that's why I think one of the two big transitions I mentioned, if you go from a clinician to an entrepreneur and a leader, is how do you think about people? How do you think about talent? The earlier you bring the right talent around you, the easier all this becomes, the more balanced you can be. Or even just having a support network, people who advise you, or give you the right mentorship. They don't need to be actual team members. They can just network. But the faster you get that set up earlier on, that means you are in turn set up for being more successful, not just in a work capacity, but also in a personal capacity as well. And so it took me, lots of up and downs to figure that out. And I'm still learning now, but I think I could have been better at it and smarter at it earlier.
I think these are great reflections. And I think the reality is with most entrepreneurs, like, as you said, we do a lot of failing, and that never stops. And so like, this is part of the learning process, right? But your reflections are definitely really invaluable nuggets of advice for doctors or anyone who is setting up a business and growing it. But anyway, thank you so much for opening up the vault of your mind, Ben, for our community of doctors. Greatly appreciated, and enjoy daddyhood. Welcome to the chaos.
Yes, indeed. Thank you. And great to be here.
Thanks. Take care.